begin this half hour with the blood shortage crisis, renewing new questions about donation restrictions. Thank you for staying with us this afternoon. I'm Glenda Lewis. As we've reported, the Red Cross says it is dealing with the worst blood shortage in over a decade. The problem being fueled by the pandemic, blood drives being postponed due to illness or staffing shortages. Tonight, the crisis is renewing focus on a federal restriction that means some members of the LGBTQ+ community cannot donate. 7 Action News reporter Kimberly Craig is going in depth to look at how that restriction started and the impact it's having on this crisis.
A lot of people may not even be aware that the FDA actually has restrictions on gay and bisexual men donating blood, and even some medical professionals say that policy puts stigma over science.
I would do it all the time, as much as I could if I was allowed to, but due to the restrictions, that's not something I can do.
Kyle Taylor is one of many Americans ready to help solve the blood shortage crisis, but can't. The FDA puts restrictions on gay and bisexual men, leading the Red Cross to ask potential donors, in the past 3 months, have you had sexual contact with another male? The FDA restricts men from donating blood if they answer yes.
It's very archaic and discriminatory, and I believe it can do more harm than good in some circumstances.
Kyle Taylor is the Development and Community Relations Manager for Affirmations. They're based in Ferndale and support members of the LGBTQ+ communities.
Data has suggested that the time period doesn't even make sense anymore.
We need the blood. This is something that may or may not have made sense 30 years ago, but certainly does not make sense now.
It was the HIV/AIDS crisis in the 80s that led to the restrictions. Dr. Gretchen Newman specializes in infectious disease at Detroit Receiving Hospital, and she talks about some of the reasoning used back then.
There was a large window period between when someone could acquire HIV and then when they would test positive for HIV. Because that window period is so much shorter and we test all blood that enters, the actual risk to the blood supply is very, very low.
Current testing window period, that is the time from infection to when you manifest a positive test, is approximately 10 days.
Dr. Robertson Davenport heads up the blood bank for Michigan Medicine.
One alternative that I would like to propose is a 3-month deferral for anyone, regardless of sex or gender, who has sex with a new partner. Now, that is going to require that we define exactly what a new partner means.
In a statement to 7 Action News, a spokesperson for the FDA says they have made forward progress and are actively engaged in re-examining the issue of blood donor deferral for men who have sex with men, taking into account the current body of scientific information. And they say they are considering the possibility of pursuing alternative strategies that maintain blood safety.
It is not just gay men, bisexual men, and other men who have sex with men who are at risk of acquiring HIV. All of us who have sex are at risk of acquiring HIV, and that window period is the same regardless of how you acquire HIV or when you acquire HIV. That period of very few days is the same for everybody.
Blood donation organizations like Versity and the Red Cross say they too look to making blood donations more accessible to LGBTQ+ communities, and they are advocating for change at the federal level. Kimberly Craig, 7 Action News.